This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
It's summer, and for many of us, it's all about fun in the sun, vacation, relaxation, a dip in a pool. That's if you're lucky. We have to talk about summer safety, of course, and you notice the pesky bugs biting your skin. But what about the bugs you can't see and will still make you miserable and sick? And of course, we're going to heat things up with things you really need to keep cool. That and so much more straight ahead on your Prescription for Life. Hello and welcome to Prescription for Life. I'm Monica Robbins. Summer arrived with a vengeance in parts of the country with a sweltering heat wave, and it's likely not going to be the last. Many of us often forget the impact heat can have on us. According to the CDC, it's the #1 weather killer in the U.S., with heat-related illness claiming more than 1,200 people a year. Overexertion during the hottest time of the day is incredibly dangerous for those with heart or lung diseases. And if you take medications, the heat can cause side effects. Most of us never think twice about the weather and our chronic illness, but that pill you pop to treat your condition may not mix well with the heat.
One thing that I think a lot of people don't know is that many medications can increase your risk, and there's so many that can do it that most people are probably on one of them or another.
For example, certain heart medications such as beta blockers, blood pressure meds, and ACE inhibitors can imbalance electrolytes, cause dehydration, reduce thirst sensation, decrease the ability to sweat, and reduce blood pressure, which increases the risk of fainting and falls. Antidepressants and other psychiatric medications can affect the body's ability to regulate temperature and impair sweating. What's worse, you may not even realize it's happening.
Or kind of blunt the response where you might have more of a warning sign. And so it might actually be that people don't really realize it until they are already significantly affected.
Here's a list of medications that can cause side effects in the heat, and it's another reason that it's really important to stay hydrated and limit your exposure to heat and sunlight. But remember, never let your medication get hot either, meaning never leave them in a hot car. They need to be stored in a cool, dry place. But what about medications that get delivered in the mail? Arizona knows a thing or two about heat, and so does our station, KPNX.
Everybody in Arizona knows what happens when you open your mailbox. It's incredibly hot in there. You have to kind of reach in and pick anything out without touching the sides if you want to save your fingers. But now, imagine you've got some mail order medication that's just sitting in this heat. What's it doing in there?
For the most part, they're just heating up, and they don't like to heat up.
Medications typically want to be stored between 60 degrees Fahrenheit and about mid-80s, 85, 86 degrees.
Dr. Brian Kuhn is a pharmacist at Banner University Medical Center. He says this question comes up a lot. Are medications safe after they've been sitting in hot weather?
We don't expect that those medications degrade into toxic or potentially harmful substances.
Your medication isn't going to magically turn into cyanide, but it might not do exactly what it needs to do. And pharmacists say you shouldn't worry so much about pills.
But certain liquids might pose a problem.
We'll think of like insulin, we'll think of injectables. Liquids certainly could concentrate more if there's a water component that somehow evaporates.
Kuhn says heat could cause things like insulin, Wegovy, EpiPens, whatever, to start breaking down, and that means they won't work as well. But Kuhn says there haven't really been any studies showing how much they break down. Some mail-order pharmacies say their packaging is weather-resistant. But to make sure, Kuhn says you can have it delivered to your office or somewhere else that's air-conditioned.
It's probably best practice to reach out to that manufacturer, shipper, or whomever, find out when it's supposed to be delivered, how it's packaged.
When it comes to heat, we know the young and old and the immunocompromised can be at risk, but many may not be aware of the serious risk extreme heat can have on pregnant women. An epidemiologist at the University of Nevada made it her mission to study these effects.
So one of the pregnancy complications that has been associated with extreme heat is the hypertensive disorders of pregnancy. So that's outcomes like pregnancy-induced hypertension, preeclampsia, eclampsia. And these conditions pose serious risks to both the mom and the baby. They're predictors of maternal mortality. And they also have implications for long-term cardiovascular health in the women who develop these conditions. There are a number of other pregnancy complications that have been linked to extreme heat, including gestational diabetes. There are quite a few studies at this point indicating that extreme heat is associated with preterm birth and fetal death, so miscarriage and stillbirth. But we do know more about the relationship between extreme heat and mortality, and we know that extreme heat increases the risks of cardiovascular and renal-related deaths. And so it makes sense that these would be vulnerabilities during pregnancy when these organ systems, the cardiovascular system and the renal system, are already under enormous strain. So a couple of outcomes that are associated with extreme heat are preterm birth and early term birth. But we care about these outcomes because they're strong predictors of both infant mortality and health trajectories over the life course. So they're associated with neurological development, respiratory diseases like asthma. And so when you have babies born too early, that has an effect long-term on health. Once infants are born, they are more vulnerable to extreme heat. They have immature thermoregulation. They have more surface area relative to their size. And so as a result, they're more susceptible to extreme heat. And we see evidence that there are increased hospitalizations during heat waves due to a range of issues in infants, including diarrhea and digestive issues, breathing problems. And so this is a very serious issue as well. Another serious outcome that has been associated in multiple studies in the US and in Canada at this point is the increased risk of SIDS, sudden infant death syndrome, during extreme heat events. Our research group has been looking at the acute or the immediate effects of heat waves on several birth outcomes, so preterm birth, early term birth, and stillbirth. And we've conducted a couple of large studies in the US. One of them is looking at 50 cities, 50 of the largest US cities. Another looks in more detail at a sample of 8 states. That includes the whole state. These studies have been based on millions of birth records and fetal death records. But even with that limited data, we can actually see that some subgroups are particularly vulnerable. Younger women, women with less educational attainment, and women who are living in areas of more poverty. We have a lot of growing evidence that social and demographic factors like economic disadvantage, like maternal age, like occupation, all those things contribute to exposures and vulnerability to extreme heat, but there's more to learn. And identifying vulnerable populations is part of determining where to put our efforts to maximize our impact in improving public health.
Avoid being outside and physical exertion during the hottest parts of the day. And hydration, of course, should be a priority for all of us, but especially pregnant women. And if you're at risk, try to access air conditioning or at least a cooling center. And always have a backup plan in case your air conditioning goes out, which we saw during the power outages in the most recent heat wave. When we come back, do you know which way your ceiling fan should be spinning in the summer? And there is a mosquito illness making a comeback, and many may have lost their immunity. West Nile virus activity is ramping up in a typical mosquito season, and while it's not uncommon to see cases, it is a good reminder this virus can lead to serious illness like meningitis or brain inflammation. Not to mention many areas had plenty of rain, which is a great breeding ground for even more mosquitoes. Those over age 50 with underlying health conditions should take precautions.
I'm more aggressive talking about mosquito bite prevention than I ever was.
USMD Mid-Cities Medical Director Dr. Joel Walker has no problem with listing off the precautions you should be taking.
Wearing mosquito repellent and DEET long sleeves and long pants in the summertime.
To protect yourself from West Nile virus.
I try not to go outside at dusk or dawn when the mosquitoes are most active.
He's so passionate because he knows firsthand what can happen when you get bit by the wrong bug.
West Nile fever for me was headache, body aches, confusion, and then I broke out in a rash.
That was back in 2020. He was lucky. He only had a mild case of what's called West Nile fever. He didn't develop the more severe neuroinvasive disease.
The severe illness. Fortunately, it only occurs in about 1 in 150 cases. So it's rare, but when it happens, you progress from what I had to an infection in the brain.
Tarrant County just reported its first human case of the more serious form of the virus.
What information can you tell me about this first case?
It's the first case of the year. They actually looks like they had onset back in the last part of June. It took a while for it to be found.
Public health officials have maps on their website so you can track where the pesky bugs are testing positive.
There is no vaccine, and there's no medicine to treat it.
Dr. Walker hopes folks look at it and take it seriously.
The only way to prevent West Nile virus is by preventing the mosquito bites to begin with.
Because he sure wishes he did. In Bedford, I'm Janelle Ford.
As always, putting on bug repellent is a great place to start. Stick to these guidelines. If you're wearing sunscreen, apply that first, then the bug spray. That repellent should go on exposed skin only and not covered with clothing. Clothing obviously protects the areas you don't want to spray. And even though West Nile virus has been around in the U.S. for more than 25 years, some of us may have lost our immunity, and those over 50, of course, could be at higher risk. Here's what you need to know from an infectious disease expert.
You know, when we think about getting exposed to it, you get some natural immunity to it, but you know, we again have to think about our youngest who may not have been exposed, and certainly our oldest who may have lost their immunity to it, and anybody else who's immunocompromised. So making sure that you're being very careful about areas around your house where you have mosquitoes, getting rid of standing water, you know, if you have any tires or anything out back that has water in it, making sure that you're cleaning those out is really important, and being really careful around times like dusk when we all know the mosquitoes come out at that time.
And if you want to repel mosquitoes the natural way, many are turning to lavender. But does it really work? We asked our Verify team to fact check.
Let's scratch beneath the bug spray. Just one bite from the wrong mosquito can spread diseases like West Nile. If you're a mosquito magnet like I am, you dislike the stinky, oily products with DEET. So let's verify a viewer-suggested natural alternative. Is lavender oil an effective mosquito repellent? Our sources to verify are the National Institutes of Health, biologist Frank Fowler with Forshaw, and the CDC, who disagree.
Lavender is actually a plant, and there's an essential oil that's derived from that plant that has long been known for its insecticidal and insect repellent qualities.
Research published in NIH looked at plant-based repellents dating back generations. It found essential oils from plants, including lavender, showed good repellency over an 8-hour test time. Online, you'll find various DIY solutions on how to dilute the lavender by mixing it with a carrier oil, but be cautious.
You want to use a product that has been researched, has some government data behind it, and has been deemed safe to apply to your skin or to apply to your yard.
The CDC does not recommend lavender oil for this purpose. The only plant-derived ingredients on its list of suggested repellents are lemon eucalyptus oil and the compound 2-undecanon found in bananas and cloves. You can look up a repellent that is EPA registered. I searched the list for lavender products and found none. So talk to a doctor before trying. With your Verify, I'm Megan Malaris.
There are a few other bugs to watch for this season, and you can easily prevent them by using precautions during that backyard barbecue. Norovirus, Salmonella, E. coli, Listeria, Campylobacter, those are the bugs that cause nasty food poisoning. Cleveland Clinic experts say always wash your hands before handling any food. Always keep raw meat away from produce during preparation, and that includes separating them in the cooler, so there's no chance the meat can contaminate the veggies. Always use separate cutting boards and knives for raw meat and veggies or fruit. Don't cross-contaminate. Cook raw ground beef to an internal temperature of at least 160 degrees to kill any bacteria. And steaks, roasts, or chops should reach at least 145 degrees. Then let them rest at least 3 minutes before being served. Anyone can get food poisoning, but young kids, pregnant women, and the elderly and immunocompromised are most at risk. Have you ever noticed that when it's really hot outside, you just don't feel as hungry? Well, there's actually a reason for that. According to Beth Cerwoni, a registered dietitian at Cleveland Clinic, it has to do with the thermic effect of food. We're not as hungry because our body doesn't want to get overheated. So we eat less so we don't produce as much internal heat. Now in summer, of course, people may also be more body conscious and they opt to eat foods with less calories, like fruits and vegetables. Another factor could be dehydration. When you're dehydrated, your gut starts to slow down and you don't digest food as well.
The other thing to remember is a lot of times when we're dehydrated, our sense of thirst is stunted anyway. So if all of a sudden you're really, really thirsty, you're probably very dehydrated. So drinking throughout the day is going to be important.
It's also really important to know the difference between heat exhaustion and heat stroke. Heat exhaustion can make you dizzy, thirsty, sweaty, and even nauseous. CDC guidance suggests moving to a cooler spot, lying down, and drinking water. But if you don't feel better within 30 minutes, get medical help. Heat stroke is life-threatening. Signs are hot, dry, red skin, a lack of sweating, confusion, and in some cases, falling unconscious. This is when you need to call for help immediately if someone is showing these symptoms. Those most at risk include those over age 65, infants, and pregnant women. Finally today, if you are using a box fan to keep cool, the CDC advises do not use it if the temperature in the room is 90 degrees or above. They won't lower the room temperature, and blowing hot air on you can actually put you at risk for heat stress. Find a cooler location if possible. As for ceiling fans, did you know the direction they go depends on the season? They might make you feel a little cooler, but they won't necessarily lower the temperature in the room. You'll want to make sure your fans are spinning counterclockwise during the summer, so the blades push any cooler air down, and you can usually change the direction using a small switch near the blades. Well, that'll do it for this week's Prescription for Life. I'm Monica Robbins. Thank you so much for watching. I'll be back next week with another dose. Until then, wishing you and yours good health. Thank you so much for tuning into Health Yeah. Please find me on Twitter and Instagram at Monica Robbins. Like and follow my Facebook page, Monica Robbins WKYC. Find video podcasts at Monica Robbins' channel on YouTube. And please subscribe. Wishing you great health and hope to see you again soon.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.